From the first greeting
Oh my goodness, look how much it's crazy.
to the big reveal,
It's a boy!
a mother's heart beats in tandem with another. 31-year-old pharmacist Jenny Gooch and her husband Garrett were thrilled about their second child, another son, due in August 2020. But in spring, the world started changing, and she learned of a workplace exposure to COVID-19.
Well, it was all kind of honestly a blur. There's a lot of panic. Everyone was very nervous.
At what point did you actually start feeling sick, and what were those symptoms?
So I was waiting on my result, and it was kind of that day I started just feeling I wanted to put a sweatshirt on in the house.
She woke up and she was like, I can't taste my coffee.
Just shy of 24 weeks pregnant, she became First Health's first confirmed COVID positive pregnant patient.
Prematurity at that age is very, very risky.
Obstetric gynecologist John Byron was her doctor.
She had COVID. She was in isolation. It was early on, so it was already high stress for her. And, a lot of the people taking care of her too, because at that point in time, everybody was fearful of contracting COVID themselves.
He knew despite Jenny's good health and smooth pregnancy thus far, the COVID risks were grave.
Definitely, if she had not had COVID, I do not think that would have happened.
The contractions just kept coming, and they started coming more frequently. And I was just laying in bed praying that they would stop. And I realized that they weren't going to.
She drove herself back to the hospital that had just discharged her.
Everyone that was in there was just kind of like, I can't believe this is happening.
No family allowed and no time to think. She delivered her son, named Grady. Swiftly, a NICU team took him away to airlift to UNC.
I try to get 4 quick pictures, through the glass of him going through the exit there to the helicopter.
Only Dad Garrett could follow and give updates. Jenny was still positive for COVID 12 days after her initial test.
Because the test we were using was this PCR test and it was so sensitive, people would be positives for months.
Dr. Gretchen Arnotzi was Jenny's infectious diseases physician who helped change UNC Hospital's COVID testing rules for mothers.
And we knew she wasn't contagious.
2.5 weeks after Grady's birth, Jenny finally held her son for the first time.
Hey, Grady. Hey, Bubby.
How does it feel to know that you were able to give a mother that opportunity?
I'm sorry. The day that she was able to go and see Grady was truly a gift.
A gift that came just in time. Suddenly, Grady's good progress took a turn when he contracted a non-COVID infection his tiny body just couldn't fight.
They said, we just want to let you guys know that we think this is going to be the time to say goodbye. All the physicians that were there that day that had been taking care of him, because everyone was so invested in making sure that Grady got home. Everyone came and surrounded us and surrounded him as he lived.
1 day shy of 1 month old, Grady died in his mother's arms. An outcome completely out of their control, but one they grapple with every day.
It's been, I don't talk about it much. So.
And I will always blame COVID for his very early birth. And I think that he would be, had I not caught COVID when I did in my pregnancy, I do feel as though Grady would be here with us.
Tragically, their COVID pregnancy story is one of many.
In recent months, with the surge in the Delta mutation, we have had several pregnant ladies unvaccinated with severe COVID pneumonia. Unfortunately, in October, we had one pass away.
Cone Health-based OBGYN Walda Pinn explained pregnancy decreases a woman's immune system. COVID ups the risk for preterm labor, cesarean delivery, maternal death, and stillbirth, consequences that now are largely preventable.
Have you seen any situations of patients with severe COVID who are vaccinated?
Actually, no, I have not. They're all unvaccinated. So I implore my patients to please get the vaccine.
In summer 2021, the leading OBGYN agencies and CDC formally recommended the COVID vaccine for pregnancy. Even still, available data shows fewer than half of all expecting women are vaccinated.
There is still a huge amount of hesitancy. A lot of that is because of misinformation or disinformation.
Especially about vaccines causing infertility. Studies like this at an IVF clinic disprove that rumor and even showed a slight increase in pregnancy success after vaccination. For Jenny, the vaccine came months too late.
Jenny could go back to Jenny being in that room in May 2020 and spending a month away from her family and losing her son. I would just want to say I would have prayed for a vaccine or anything like that that could have helped protect us.
In 2021, answers to prayers. She got the shot and a much bigger dose of faith. The baby girl they know was heaven sent.
Now we have a healthy 7-month-old attempting to crawl around, so keeps us on our toes, for sure.
Yet even amidst great joy, the grief can resurface.
Sometimes I still can't believe that happened to us, and I still can't believe that I had to watch a child take his last breath on earth in my arms.
What do you want Grady's legacy, his lasting impact to be, if you could pick?
His short life mattered a lot. I just want his story to reach as many people as possible, and to help save other pregnancies and other babies from enduring the same.
And to help other bereaved parents know, after a storm, there is sometimes a rainbow, a silver lining of love and hearts full of hope beating forward. In Greensboro, Megan Maleris, WFMY News 2.